Veterinary medicine is a messy business both physically and emotionally. Vetsplaining is one veterinarian's attempt to explain and understand her own profession a little better. Join Dr. Lisa McFadden as she delves deep into the medical and business aspects of veterinary medicine.
So last time we talked about the importance of allowing the support staff to restrain pets for physical exams. And this time I thought it would make sense if we talked about the physical exam and why it's so important. And in human medicine, and I mean no disrespect to my human medical counterparts, their physical exams are pretty sad in comparison. I mean, if you go to a general practitioner or a nurse practitioner for your primary care physician, like they'll kind of look in your eyes and your ears and your throat and listen to your heart and kind of like squish on your belly. But it's very abbreviated. I mean, they have 15-minute appointments, and that 15 minutes is not for the exam. That 15 minutes is get them in, get the nurse to get the vitals, do the exam, get them out. So it doesn't leave a lot of room for a thorough physical exam. In veterinary medicine, because our patients cannot talk and tell us what's wrong, a thorough physical exam is absolutely crucial. And in human medicine, I think the closest comparison would be the pediatrician. Our pediatrician is fantastic, and I'm always impressed with her physical exam, even if he's just coming back in for a recheck. And again, my kid JJ can talk a little bit now, but he can't. He's only 2 and a fuzzbit, so he can't really verbalize anything more than like boo boo, which is new as of last week. So I think that from a just logistical standpoint, the physical exam is what's going to provide us with our initial information. And even if it's a well check, like it still allows us to ensure body systems are okay. And most veterinarians start at the head and work to the butt. Some veterinarians start at the butt and work to the head, but they almost always do the exam the exact same way every time. And the reason is that repetition and having it done in a precise way helps abnormal stand out. So if you're always going, let's say, nose to tail, your brain can play which one of these is not like the other while you're going through each body system in order. I gotta be honest, I most of the time do everything in the same order, but realistically, I tend to start with what end I'm presented. So if I'm presented with the face, I'll start there. If I'm presented with the butt, I'll start there. And then sometimes, depending on why they're there, it'll help me determine which direction I want to start in. For instance, if they're there for an eye issue, I may start with the tail and the butt and work my way up to the eye because I get distracted. So I don't want to put all my energy into the eyeball at first and then miss everything else. So this way, if I save the problem for last, it allows me to formulate my own opinion about the rest of the patient. But for the purposes of this podcast, we're going to start with the nose and work our way back. So the first thing we do as veterinarians is we like to observe how the animal stands and walks, and that's usually easier for large animals. Small animals, a lot of times clients already have them on the table when you get in there, which is nice. I mean, they're trying to be helpful. So then I'll watch them walk around when I'm done the exam. But what we're looking for is, are they bearing weight evenly on all 4 limbs? Are they doing what's called offloading, meaning when they're standing, like do they kind of shift their weight subtly so that they're putting more weight on one limb versus another? And when we talk about limbs, we have to talk about thoracic, right? So the front legs and pelvic or the back legs. And normally dogs bear about 60% of weight on their thoracic limbs. And if they have an injury of their front legs, it's going to make their weight distribution a little weird, right? Because they want to put it backwards. So they're going to take it off the leg that hurts and then also push some of their weight backwards. If they have a problem with their back legs, then they'll put even more weight on their front legs and eventually start to kind of look like Jack LaLanne. Like they'll spread out their front legs a little bit and like kind of beefcake in the front and a little spindly in the back. And it also lets us look at their head position a little bit better. So if they have a head tilt, sometimes you can notice it more. And if we're concerned about neurologic conditions, it can let us evaluate if they're pacing or they're circling, more importantly, because if they are circling, is it always in one direction? Can they actually turn the other direction? Do they appear visual? So there's a lot of information we can gain just by watching them walk around. And I do a lot of lameness exams even when I don't mean to, so it's really hard for me to just look at your average dog and and say, oh, wow, they're bearing weight equally on all 4 limbs. And so I try and keep it on the inside when I'm not at work, just because most people don't want like some random stranger telling them, hey, did you know your dog is limping in that left rear leg? It's not really like a fun parlor trick that people request. So we watch them walk around. We watch their interactions with us as well as their interactions with their humans. So do they recognize us? Can they hear? Are they responsive? Do they smell treats if we give it? Do they listen when they sit? How do they sit? Because that also provides good orthopedic information. And then we start with the eyes. So for me, I always have to remind myself, okay, look far before you look close, right? So there's that expression, like see the forest for the trees. So you want to make sure you're looking at the whole before you're looking at the very, very small. So we look at the face, and we're looking at things like, again, is there a head tilt? How do they carry their ears? So dogs with upright ears, do they look even? Dogs with floppy ears, does the part, like the flat part of the fold of the pinna or the ear flap, is that even on both sides? Does their face look symmetrical? Are their lips drooping on one side versus the other? And then we look at the eyes. Are the eyes clear? So there's the sclera, the white part, and the cornea, which is the clear part that covers the pupil. Is the cornea clear? Is the sclera white? Are the eyelids appropriate? Sometimes they can get drooping lower lids. That's called ectropion. They can get eyelids that curl inward. That's called entropion. So your like classic ectropion dogs would be like bloodhounds with like those lower lids that like just make these little pockets because their lids are so droopy. And then Shar-Peis are kind of your poster child for entropion or rolling inward. And does the cornea look what we call lackluster? Does it look dry? So you think of like your bug-eyed dogs where they can't totally blink all the way. And like physically, they literally cannot sometimes blink all the way. So the cornea looks visibly dry. And are both eyes open the same amount? Are they squinting? Are the pupils the same size? So when the pupils are not the same size, because remember, we have to have a name for everything, because that makes us fancy. So anisocoria is the name of what you call it when the pupils are 2 different sizes. And then if they are 2 different sizes, you got to figure out like which one is the abnormal one. Is the small pupil the abnormal one, or is it the big pupil? And then we use an ophthalmoscope, which is it's a handheld device that allows slight magnification to look in the back of the eye. So we're looking at the lens, we're looking for cataracts. Anytime you see a bluish hue, a lot of times people assume that's cataracts. The first thing you have to do is figure out, is that blue hue coming from the cornea, the outside of the eye, or the lens itself? And if it's like a whitish blue and you can see through it, then that is called nuclear sclerosis. It's a normal age-related change. It's a hardening of the lens. If you can't, then that is a cataract. And then there's varying degrees of cataracts. And we look in the back of the eye and we look at the retina and the optic nerve. And I want to start doing interviews, so I'd love to have a veterinary ophthalmologist on, and then they can tell you about all the weird things that happen to like 2 of the tiniest organs in the body that get so diseased. But they're very important. And they'll go into much more detail about the way that they do eye exams. And realistically, I just need to work on figuring out how to logistically do the interviews. So once I do that, there's no stopping me. And we will have even more topics. And you won't just have to listen to me blab. You can listen to other people blab. That's very exciting. So then we look at the ears, and we use an otoscope to look at the inside of the ear. So we look at the ear flap itself. We look at the external canal. We use the otoscope to look at the vertical and the horizontal canal and the eardrum. And if you want to learn more about ears, I actually already did a podcast about ears, so you can listen to that. And then we look at the snout. Okay, so when you're looking at the muzzle, you want to look for symmetry. You want to palpate it, so feel it. Make sure it feels symmetrical and normal. You want to make sure there's normal airflow through both nostrils. Nares is what we call the nostrils, basically, in dogs, in cats. And you want to make sure that there's no discharge, there's no discoloration. So some dogs can get this thing called DLE, or discoid lupus erythematous, which is a condition in which basically the body attacks the nose, and it causes, like, we call it a depigmentation. So a lot of dogs have like a black nose, so it'll make it more pink. It can get ulcerated and inflamed, and it needs certain treatments. You can also get infections of the nose, which, as you can imagine, are hard to treat because, they lick their nose constantly. And then we look at the lips, and we make sure, is there anything like a lip fold infection? So that's more common in the lower lip, right behind the canine. That like little redundant area of lip tissue can get infected. And we make sure that they are evenly droopy. And then we look at the mouth. And we will definitely do other topics about oral health and dentistry. But for kind of a brief overview, we're looking at, do they have all their teeth? Do they have extra teeth? Did they lose their baby teeth? So baby teeth should not be present after about 6 months of age. And some, especially Yorkies, like to keep their baby canines. So they're called deciduous canines. And those can be very problematic because they can disrupt the way that the adult canines erupt. They can trap food particles and cause they can cause infection and inflammation. So we see, do they have all their teeth? If they don't, does it look like the gum is healthy, right? Because you may not know if that animal had previous dental work done. So you just want to make sure that any area of the gum in the mouth you're evaluating. And you want to see the level of tartar that's on the teeth. You also want to evaluate the gums. Does it look like there's any gingival recession or receding gum line? Are they red? Are they like pussing? Some dogs with really bad teeth, especially like where the tooth meets the gum line, there can be a lot of pus. And some animals and people actually can get an overgrowth of gum tissue called gingival hyperplasia. Kind of your poster child for that are boxers. Like they're like, and they have just all that gum tissue in there. Sometimes you actually do need to surgically remove it. Sometimes you just can monitor it. And then we want to look at their tongue as much as possible. And in Chinese medicine, which we'll do another time, you look at the tongue for like a whole variety of reasons. It helps you with your Chinese medical diagnosis. But from a Western standpoint, you're making sure that, yeah, sure, you want the coloring to be pink, but realistically, like the gum color is more important than the tongue color from a Western standpoint. But you want to make sure there's no ulcerations. You also want to look on the inside of the lips to make sure that there's no ulceration there. Sometimes with really severe dental disease and there's chronic contact of the tongue with the diseased teeth, you can see ulcerations. You also want to look at the bottom part of the tongue to make sure there's no swellings, or sometimes they can get growths. Then we're moving. I know, that's so exciting, right? Like 11 minutes about the head of the dog. And then we're moving and we're touching below the lower jaw, back by near the throat. That is where the submandibular lymph nodes live. That's kind of what we think of when we think our glands are swollen when we're sick, and you want to make sure they're the same size. You can also feel the large salivary gland as well, and you want to make sure those are equal. And then we kind of work our way down, and we're feeling the throat area and the neck. And as far as the neck goes, you want to make sure that they have good mobility. You want to make sure it can extend, flex, turn left and right. And then for the throat, you're making sure it feels equal. There's no sensitivity. They don't have like a cough elicited when you touch it, because that could be anything from kennel cough, which is actually canine infectious respiratory disease complex, unless they've changed the name in the last 3 days. Or it could be like a collapsing trachea. Sometimes those dogs have sensitivity and they'll cough when you touch the throat. And you also want to feel to make sure there's no swellings in the throat that could potentially be like a tumor on the thyroid. And that also goes with cats. And honestly, like a lot of these exam findings, a lot of these exam procedures really are the same for cats. There's a few different techniques that you may use as far as how you go about opening the mouth of a cat versus opening the mouth of a dog. And the kitty tongues are barbed as opposed to the flat, smooth dog tongue. And then for cat throats, what you're going to want to do is you're going to want to deliberately try and feel for the thyroid. So you extend the neck, and I kind of think of it as like I'm holding the head and neck so that it's extended enough that the cat's nose is basically pointing where the wall meets the ceiling. And then I take I'm a lefty, right? So I take my thumb and my middle finger and I start just below the jaw on either side of the trachea, and I slowly go down. And usually right around the area of what we call the thoracic inlet, or where the chest cavity would start, that's where you're going to find these thyroid slips, we call them. So if you feel a palpable goiter or an enlarged thyroid in a cat, that's usually where you're going to feel it. And sometimes you'll feel prominent thyroids on both sides, or you'll feel like a definite nodule on one side versus the other. And in cats, it's less common for them to cough when you touch their throat. That's usually indicates that there's something going on. So then I'm going to go from there. I'm going to feel the front legs. And some people do body systems. So like they'll do the trunk and then they'll do their lameness exams or their